Welcome to our podcast, Psychiatric Services from Pages to Practice. In this podcast, we highlight new research or columns published this month in the journal Psychiatric Services. I'm Lisa Dixon, editor of Psychiatric Services, and I'm here with podcast editor and my co-host, Josh Berezin. Hi, Josh.
Hi, Lisa.
We have another remotely recorded podcast, and this month I am really excited that we will be hearing from John Torres, who's going to be talking to us about apps and college mental health.
Should be a great conversation. We're very lucky to have Dr. John Torres, who is the director of digital psychiatry at Beth Israel Deaconess Medical Center and an instructor in psychiatry at Harvard Medical School, on to talk with us about his recent article, Smartphone Apps for College Mental Health, A Concern for Privacy and Quality of Current Offerings, which he co-authored with Jennifer Melcher. So, Dr. Torres, thank you so much for joining us.
Thank you guys for having me and letting me discuss this paper and research.
So, we usually start out these conversations with a question about how you kind of came to this particular area of research in your career.
So, it's a really good question. To save you guys a 10-year saga where I'll kind of outline my life. I think the brief story is my background in college is actually electrical engineering and computer sciences. So I've always had an interest in technology, and I think you can imagine that mental health and smartphone technology really is a wonderful intersection of using the best of mobile health, digital technology, smartphone apps, and kind of psychiatry and clinical research. So the intersection has been an area I've been really excited to explore.
And we skimmed over that you have a title that I don't think anybody else has, the director of, or that at least we've had on the podcast, the director of digital psychiatry. Can you tell us a little bit about that? Is it an initiative or a department, or?
What does that mean? We all need to have a director of digital psychiatry in our departments.
No, that's definitely a good question, Dr. Dixon. And so we made this new division about 2 years ago. And the idea was that we were doing more research in this area of digital psychiatry, looking at online medical records, smartphone apps, clinical informatics. But the reason we decided to make it a division is we were also doing teaching of residents. We were offering medical students electives. And we actually started offering a small clinic where we would see patients and give them what then was routine face-to-face care, is now routine telehealth care, but we would have them use apps and technology to supplement and augment their care. So we said, if we're doing this research, we're doing teaching, we're doing clinical care, we're kind of doing all the parts of a division. So we're a small division in the Department of Psychiatry, but with our hospital and department support, we became a division of digital psychiatry. I think we may have been one of the earlier, but I think certainly now in the world and with COVID, I expect that there'll be many divisions of digital psychiatry, which is a great thing for the field.
Mm-hmm. And this particular paper is about college mental health. So why are colleges such a great place to study digital psychiatry?
So I think colleges really are, they've always been part of the research ecosystem, certainly. And in Boston, we have, I'll just say, hundreds of thousands of college students. And certainly based on where our hospital is located in Boston, we're always working with college students. And in essence, I think we can all imagine that almost everyone has some access to digital technology in this day and age. It can be of different quality and they can use it differently, but college students as a whole, will just generalize, often nearly all of them have a smartphone, and as a generation, again, we'll stereotype them, but say that a lot of people are interested in using technology towards advancing their own health and even their mental health. I think we've seen that even from geriatric populations are interested in digital mental health. It's not that any one population doesn't want to use it, but I think that college students really bring that technology ownership, the literacy, and the interest that kind of reduces some of the barriers that there may be in working with different populations.
So can you give us a little bit of the sense of the landscape of digital mental health or digital psychiatry on college campuses right now as kind of a little bit of a background for the study that you did and what sorts of issues and concerns are coming up in college mental health around the use of technology?
Yeah, it's this landscape of digital mental health, and especially digital mental health focused for college students, is very dynamic. I think it's rapidly evolving and changing. You could almost argue that every month, especially now with the acceleration of COVID towards digital health, it's always rapidly changing. And I think what in part prompted this study was we know that there's a crisis in college mental health that for various reasons that aren't fully understood, but these colleges are seeing a huge increase in demand for mental health services by students. This could be related to decreased stigma. It could be related to kind of higher burden of illnesses in students. There's many reasons that aren't fully known, but as these college counseling centers have kind of been faced with higher numbers of students seeking help, they've looked towards technology to help kind of increase access and availability of care. And there's different ways that colleges can use technology to help students. They can offer kind of online computer-based programs. You can imagine kind of a self-help CBT-paced thing. They can offer students smartphone apps, things they can download on their phone and use today. They can connect students to external telehealth vendors who may see students. They can offer kind of peer support groups. But to answer your question, it's really actually hard to sometimes track what's happening on a unified level because everything is so new, the technologies keep evolving, and each school, in part, may be kind of adapting to it differently or uniquely. So we know that the ecosystem's growing. We just don't always know what's happening in it.
And so in this growing ecosystem, I think one of the things that the paper is looking at, or kind of by way of background, is sort of like what are some of the pros and cons, or what are some of the potential drawbacks?
Yeah, no, so we've done some prior work in the digital mental health space. And I think that there's been many different groups kind of been concerned about. We know there's benefits of using, say, a smartphone app for mental health. It's instantly available, it's on your phone, it's easy to access. But there's certainly been concerns raised about what is the security and privacy of health information on these smartphone apps. A lot of these apps may look like they're mental health devices, and thus you would expect that they protect your privacy, they follow HIPAA. But if you kind of read the terms and conditions, actually these mental health apps, a lot of them say, no, it's a wellness device. And as a wellness device, they're not subject to all of the medical regulations that listeners of this podcast are well familiar with, and all the kind of demands for privacy protection. So, and I think even there was an article actually in the New York Times, maybe last month, even looking at one popular app called Talkspace, I think, that kind of just highlighted a lot of kind of questionable things about how sensitive health information is used that the New York Times brought up. And our group has presented to the Federal Trade Commission, the FTC, in July of this year because the FTC was worried about consumer deception and kind of saying that these apps are really making a lot of claims that may not kind of be accurate. So the FTC is not the FDA. But the fact that the FTC was even interested in kind of, are these apps kind of promising too much and also kind of making false claims about privacy or kind of deceiving consumers? So we were a little bit worried about kind of what could be happening to data. And I think likewise, we were a little bit unsure about what was the evidence supporting these apps. I think there's been some fantastic research, and many of it published in this journal in Psychiatric Services, on kind of what apps work, how they can be better, what we should be using today. But I think all of us know if we just type in depression or anxiety or stress into the app stores, you can also come up with some pretty concerning apps that none of us would probably want people we work with using.
So John,
It
sounds, as you're talking, it's almost sounds to me like, going to the vitamin store and getting health supplements that are not necessarily properly controlled. You don't know if they really work. They look good, healthy, et cetera, but really potentially problematic.
I think that's the perfect analogy. These are like online supplements, right? These are digital supplements. But it's also to say for sometimes they're really helpful, right? We know that alternative medicines, we know that vitamin C can be very helpful. It can help augment things. It's not the primary modality, but I think that's the right analogy of we're going to the drugstore, we're trying to figure out what's good and what's not good.
Is there an app that you've seen that it sort of stands out in your mind as a particularly egregious example of something that is would clearly raise concerns among treatment providers?
You know, if you type in still today, like schizophrenia into the Apple or Android store, I think you get up a game about using your schizophrenia medicines to play Pong. And if you lose your medicines in the Pong game, it says you lose your mind and you lose.
Okay, that seems pretty straightforwardly. Okay, good. I have a sense of what the concern now, for sure.
But, you know, Josh, it's a good point. But there's also more subtle ones. There was a different paper in December of last year that showed that there were about a whole collection of apps that had incorrect suicide hotline numbers in them. And these apps had been collectively downloaded by over 2 million people. And it wasn't that any app developer was trying to withhold information, but they may have not known what to write hotline words. They may have not updated those phone numbers. So sometimes the harms can be a little bit more subtle like that. And I think perhaps the even more subtle harms are a lot of times these apps just don't work. They'll say this app is inspired by CBT. And that's like me saying, my cooking is inspired by great French chefs. And I invite you guys over and you would go, this doesn't taste like a great French chef. And I go, but it's inspired.
Okay, so we won't be coming over for dinner anytime soon. Is one thing that we've learned from the interview so far. Okay, so obviously some really major concerns. It's such an interesting point about the more subtle ones. Kind of the more that it looks like something that has had a lot of thought go into it, sometimes the more potentially dangerous that could be. So tell us a little bit about the study. What did you do, and what were some of the major findings?
Yeah, so how the study worked is we discharged a lot of college students from our emergency department, our inpatient unit. We see them in our own outpatient clinic. And we knew that colleges were recommending apps by putting on their website. You can actually find some of these recommendations yourself if you type in your favorite university name and kind of mental health. Their counseling center may have a webpage of mental health apps. And from talking with some students and kind of looking at those lists, we said, hey, some of these lists are interesting. The apps that they're recommending, some seem good, some seem okay, some we don't know about. We said, what are colleges across the United States recommending as mental health apps or kind of putting up on their websites? So we wanted to get a good sampling of different colleges across the country. We didn't want to pick just one region, New England, the Southwest, the Northeast. So we use the US News and World Report rankings. Clearly they have issues, but we use as a way to say, what do they consider kind of 30 liberal art colleges, and what do they consider to be 30 kind of, in their word, top colleges, to give us a sample that turned out to be fairly diverse in colleges. And then we actually went to their websites that you could find publicly facing and looked at what were all the mental health apps that they were listing there, that they kind of told people directly or indirectly or sometimes clearly, you should try this, you should use it. So we collected all of those apps, and then what we did is we basically investigated each of those apps. So we found basically 218 suggested apps, and then we downloaded them, we looked at them, and we coded them in ways to understand. We actually read their privacy policies. If you want to do something really boring, you can read 218 app privacy policies, highlight words. This was done with Jennifer Melcher, who's a fantastic research assistant, and we just kind of looked at these things. So we kind of read the privacy policies and coded them. We coded what happens to information given to the app. We looked at, can you delete your data? we also looked at what is the type of research evidence that these apps have. And we realized not every app is going to have a double-blind, placebo, randomized controlled trial. Which I don't think any app for mental health has that today. But we wanted to see, do they have any research base? Have they, well, this way, was an attempt made at research, which is probably better than no attempt was made at research.
Did they actually go to cooking school?
Exactly. Right. Did they try? And we also want to look at when was the app last updated. We've done some prior work to suggest that if an app has been updated in 180 days, in half a year, it may be the developer has kind of abandoned it. It's what's called a zombie app, which is a red flag. And we also wanted to know, this is a basic one, does the app still exist? Can you actually download it?
Did you mention zombie in the paper? Because I would have remembered that.
I don't think we called them zombie apps at 180 days, but you can imagine a zombie app is one where the developer, the brain of the app has just walked away. And it basically just sits there on the iTunes or Android store, right? And there's probably no one overseeing it, maintaining it, and updating it.
Well, I love that. I love that concept as a zombie app. Well, and while I have the floor, I just want to tell our listeners that there's a nice list of the questions that John how John and Jennifer interrogated the apps in the paper itself. So you can catch that in the paper.
So what were some of the take-home findings from all of that scintillating privacy policy reading that you did?
So I think we found, like most things, some good, some not great, but only about 61% of these apps are kind of recommended had a privacy policy. It's like the presence of a privacy policy, not even going into it. So that means roughly 40% are giving students in colleges, you have no idea what's happening, right? And that's certainly concerning that 40% really just don't even tell you what's happening. We knew that about 54% were kind of collecting what would be close to user information. It may not be directly personal health information. It may be de-identified, but they were collecting something that was kind of related to individuals' information. And only 30% would actually let you delete your data, which was also concerning. So I think that we found, and this may be in line with the general marketplace, that overall, these are basic things we'd want, right? There is a privacy policy. You can delete your data. You can understand what's shared about you. So some of the kind of fundamental basics around privacy really weren't there. And I think what really surprised us was 28% of the apps really didn't exist anymore. So if you were a student, you went to the website and the college says download app XYZ, almost a third of the time XYZ doesn't even exist. So that kind of tells you that what these colleges are recommending is a little bit out of date, or perhaps not out of date.
Yeah.
Yeah. So those aren't even zombie apps. Those are like in the cemetery already.
Yeah.
So, and what about in terms of the evidence base for some of the apps?
So what was interesting is basically we found that 16% kind of had some type of efficacy research. So not that much, right? To say that 16% had some efficacy research. And I say some efficacy research because we were very liberal in how we coded efficacy research. If there was a paper published in any journal that kind of tried to do something with efficacy, we said that was. And you can imagine that you could have a paper. We could make our own app, and we could put, does our app make people feel better compared to putting people in a pit full of snakes? And we compare the two. And we say, well, technically our app was better than the pit full of snakes. And there's no research that's that egregious, but I guess I'm saying you can have some pretty uncontrolled trials. You can have some biased groups. You can have some self-funded studies, and we counted those. So even kind of counting these studies that would make some of us kind of cringe to say that's really efficacy evidence, it was still only 16%. And again, so that's not to say these apps don't all work, right? It's just that we don't really know a lot about them or how they work or who they will work for or at what dose they should be used or when they should be used.
And maybe they don't work.
That too, yes, certainly. Some of them may not work. Some of them may have iatrogenic effects. Some of them could be harmful too.
Yeah.
So it seems a little bit like the Wild West on some of these web pages about what they're recommending. But you know, in the discussion section, you also come up with two what seem like pretty straightforward steps that college mental health organizations can take to make things better.
Yes, exactly. I think one that kind of makes intuitive sense is if we think of apps in the same way that we think of therapy, we may think of medications, is you want to do some informed decision making around picking them or suggesting which ones to use. Mm-hmm. It's a little bit different, as Dr. Dixon said, but it shouldn't be like going to the drugstore and kind of picking your supplements. So just as kind of a college would, if they were going to put out a list of the best medicines, they'd probably think about it. They'd have a list of kind of why it's the best one. They would talk to different stakeholders. That they would think about the pros and cons, the evidence, the usability, tolerability. And that same decision-making can be applied towards technology, right? We could think about what are the risks and benefits of each offering? What is the tolerability or usability? And how is it going to be clinically integrated? And in part, this is related to our work of the American Psychiatric Association on our app evaluation model. And there's no real secret to what the app evaluation model is. It just says, let's think of, again, risk benefit. Let's think of ease of use and clinical integration. And you can imagine that colleges could kind of have committees, right, with students, with college counseling centers, even if technology companies on them they want, that really kind of sit there, look at what the current recommendations are, understand in the local context how those different criteria are met, and then update it. Just as we know that apps on our phone update, we've talked about zombie apps already. So with a little bit of thought and curation, I think colleges can kind of take these recommendations right now that are a little bit harmful and turn them into something that's really relevant and useful for everyone.
John, so here's a question about that. So I'm a psychiatrist. You're a psychiatrist. We have a lot of mental health professionals listening to this podcast. And I find myself wondering, if I work at a college mental health center, or I'm in charge of it, is there any liability for me if I do not check out the kinds of tools and apps that are promoted on the campus website?
You know, this is a really good question about the legal liability of using these apps. And I think, honestly, right now, it's an unknown question. It's actually 2 years ago, we looked at case law to see if there are any kind of lawsuits pending around mental health apps. And we actually found none. But again, that was 2 years ago. And we began to see that there were lawsuits coming out around Fitbit, around people saying Fitbit told me to over-exercise or under-exercise, and I got into trouble with it, or it gave me kind of inaccurate information. I haven't yet seen case law emerging around this, but certainly you would think if a reasonable consumer feels that there's a recommendation made by a college and they're using something recommended, you would certainly think that there would be case law. There would at least be, it would be interesting to see what the results of that are. And I think it also would make sense for colleges to be able to show that we actually have put thought into what we're recommending, right? This wasn't a list that was made by going to the iTunes store, picking the top 10 and putting it publicly facing. But it really is an unknown area, or one that I certainly am not sure what the current legal status of it is.
Maybe we should get a Paul Applebaum consult. He seems...
It would be interesting to see what he thinks of it.
We can have you both on the podcast to hash it out. You know, one of the other things that the paper made me think about is, you know, I'm probably a bit of a Luddite, and I'm like comfortable with apps now. And, you know, meanwhile, the world has moved on to all sorts of other things. And I'm just wondering if you see anything coming around the corner that will, like what's the paper that's about this in 5 years? Is it going to be like about college mental health centers recommending virtual reality, or what are some of the kind of emerging issues that are either brought up by this paper or just in the field in general?
So I'll speculate here because even with my psychiatry training, predicting the future has been hard, I've learned. But I think what's interesting is this paper didn't quite cover. We just looked at what is the availability of app offerings. But once a student actually begins to use these apps, or any person, there's very good data that engagement is not very high, that people will start using them but quickly stop using them. And clearly, just like with any therapy, medication, exercise regime, or app, you do need sustained engagement likely to get some type of effects. And I think what we're probably beginning to see is the real innovation in digital mental health may not be the technology, may not be the machine learning, the artificial intelligence. It may be, can we kind of create new hybrid clinical services that work really well with mobile technology and telehealth and are co-designed to take the advantage of both. So it's not just the patient going, here's new app data, please look at it. And the clinician goes, oh my gosh, we don't have time to do all the things we want to do. And now you're bringing me all this complex data. So it's almost, can we kind of create these new digital services, these clinics that really bring the best of face-to-face care to therapeutic alliance and the best of real-time data and self-help and apps in a way that's synergistic. And again, not opposed, right? Today where it can just be, what would you do if you have a patient and they bring you reams and reams of app data and you go, where do I start?
Mm-hmm. So it sounds like there's a lot of future research questions to answer about the use of technology in college mental health. John, is there anything else that you want our listeners to know about the paper or about digital mental health?
So I think one thing I would add is in part based on this research of trying to figure out what apps are out there and what they offer is our team has created a completely free to access, no commercial affiliations website called apps.digitalpsych.org. And on apps.digitalpsych.org, we've taken about 250 kind of common or popular mental health apps and rated them against kind of 105 dimensions, including ones listed in this paper. And the idea is we're not here to tell you what app is good or bad, but you could say, search all the apps in Spanish that do CBT and have really great privacy things, and I'll show you a list, and that may be none. Or it'll say, tell me all the apps that have a chat bot and that have a feasibility study, and that may be 2 or 3. And I think what's fun about kind of going to that website is you can just play with different filters and begin to get a sense of what exists, what doesn't exist. And you can imagine, I think, resources like that could be very useful for kind of solving some of the issues we presented in this paper, right?
Both for the person using the app, but also it sounds like it could be a real tool for some of the people putting together the recommendations for what apps to use for students.
Exactly.
Well, thank you so much for coming on the podcast today. It was a really fascinating conversation, and it's such an exciting topic because we're all interacting so much with technology, and as you said, all the more so during COVID. And it's just great to read something that can synthesize some of the questions and really inspire some additional critical thinking about the technology that we're using in our field right now. So thank you again so much. It was a real pleasure.
Yeah, thanks,
Thank
John.
you both. Thank you both for having me.
That's it for today. We invite you to visit our website, ps.psychiatryonline.org, to read the article we discussed in this episode, as well as other great research. I also want to call your attention to a new column that will be appearing in Psychiatric Services on lived experience, inclusion, and leadership. And the editors of that column are Neb Jones and Karis Myrick. So I'm really excited about that. We welcome your feedback about the podcast. Please email us at psjournal@psych.org. I'm Lisa Dixon.
I'm Josh Barrison.
Thank you for listening. We'll talk to you next time.